Welcome, everyone, to another episode of Talk Your Abs Off. I am joined by my wonderful friend and previous colleague, Jaclyn Maynard.
Hello.
And I am so excited to be talking with her today. Today, we're going to be chatting a little bit about endometriosis, some other chronic conditions, and kind of what health and wellness and routine can look like when going through something difficult like that. So, Jaclyn, if you want to start just by sharing a little bit about who you are.
So I am a former psych major. I've always kind of worked in like food, health, wellness in some capacity or another. I used to work in food service. I've done psych. I've done personal training, Brazilian jiu-jitsu, and then you and I were health coaches together. So I feel like I have a wide array of experience to pull from with this stuff.
Totally. And share a little bit, if you don't mind, about like the health coaching experience. I know you and I could talk about this for a while, but just tell me a little bit about your experience and kind of what you learned about working with other people when it comes to helping them along like their journey.
I think the thing that stands out the most is how much it's not just like a couple of bullet points. It's more like a web of connected things. So like you don't just focus on exercise. You don't just focus on what you're eating. You don't just focus on like your mood and your sleep, but it's all so connected because your body can't do what it needs to do if you don't have all the pieces working like cohesively together. That makes sense.
Yeah, 100%. Yeah, I would agree with that. It definitely puts things into perspective instead of trying to fix everything all at one time. It's,
Yes.
Focusing on small things, one thing at a time.
Yes. And that they all matter, even if it doesn't seem like it. Like the sleep was the one that it took me a while to realize how much that affects like what I'm craving and how I digest and if I have energy to do anything. And like it's all so connected.
Absolutely. Yeah. And that's the big one that I feel like a lot of people miss a lot of time is sleep. So I love it. That's the one that always goes to the wayside, right?
Right.
Oh, I love it so much. Well, thank you again for joining me. You and I have talked a lot about endometriosis, and I know that you have experience in your own personal journey with endometriosis. Would you mind? I know I don't know a ton about it. I kind of know the basics. I have a couple of clients that are working through that as well. But can you just share like what is endometriosis and how it affects someone's body?
Yeah. So I'm just going to preface this. I'm not a medical professional, but I've been dealing with this for many, many years. I was trying to get a diagnosis while you and I were working together at our last job. What I believe I learned is that endometriosis is when you, like most women have your lining that grows on the inside of your uterus every month, and then you shed it when you're menstruating. And when you have endometriosis, that lining grows just in your body outside of your uterus, and it's different places for different people. Like mine specifically is on my reproductive organs and my hip flexors. So that's where I'll get lesions. That's where they develop. That's where they grow. So that's where a lot of my pain is localized. But some people get it up in their abdomen. Some people it's even higher. So they found it in like organs like all up in your chest and your back and just crazy places. And still, it's only recently being studied as like focused as it is. So that's still like learning a lot about it. But that's what I know. And the other thing I want to mention is that I know it's talked about as having like very painful periods, but it's more than just your period. Like it's not just that week that you're menstruating. It can be as many days. It can be before, after. I know when mine got to the height that it did, it was 20 out of 30 days that were debilitating pain. And then I just had pain like on and off those other days. And everybody's experience is different, but that's mine. Very much pain. And then like with chronic pain, there's like, your working memory, your short-term memory isn't very good because your brain is distracted. There's, anxiety and depression that comes with that, of course, because you're not able to do what you want in your life, and things just they tend to snowball if you don't have a diagnosis and you're not like working with someone who can help you.
Yeah, absolutely. Thank you for shedding some light onto kind of what that looks like. Are there other other symptoms besides, like I know you mentioned, like the how you're thinking, your anxiety, depression, and the pain. And do you also can you explain a little bit like what causes that pain? I guess I'm not really sure where that comes from.
Yeah, I'm not totally sure myself, but I know a lot of it is to do with where the lesions are. So, like mine, for example, are on my hip flexors. So, when my hormones, and I believe it's specifically estrogen, is higher, then that's what helps those lesions to build and like grow in new places. And I know specifically like, when I can feel them in my hip flexors or like on my ovaries, I can feel when that's like kind of throbbing, and then everything just gets tight. So all of my muscles are tight. I learned recently that it's very common with women who have endometriosis that their pelvic floor muscles are not firing how they should because you're in pain. So everything's just clenched, which is like our natural response to pain is to just clench up. But then after a long, chronic time of that, years of that, then your body is just clenching and it doesn't know when to release. And then you're kind of compensating with other muscles, and that can lead to, muscle imbalance kind of thing. So yeah, it can
Yeah,
kind of snowball.
yeah, that makes a lot of sense. And I actually didn't know that it could be like in other places outside of around like the reproductive organs. So
Yeah.
that's crazy.
Yeah, that was new to me too. They only can diagnose you officially at the moment with a laparoscopic surgery. So they have to see it to be able to tell you where it is and stuff. And that's when I learned that. So just a couple of years ago.
So it's kind of an invasive process to figure out if someone has it.
Very, unfortunately, very. Hopefully they're
Wow.
going to be able to figure other stuff out, but that's what it is now.
That's where we're at right now. Absolutely. I mean, gosh, that in itself is like huge challenges. What are some of the other challenges that people like with endometriosis face as you're kind of dealing with all of this?
Yeah, I think the one that I had the most difficulty working on was feeling like invalidated by like my doctors and stuff because I've known something is wrong for I think it's been 12 years now, and I only got diagnosed a couple of years ago. So it's a lot of time and energy I'm putting into trying to get people to believe me. And it's like a pain, any kind of a pain illness is like an invisible one. Like you can't like look at me and see, oh, she's got endometriosis. You can't see that. So it's hard, I think, for people to like other people to understand if they don't see you like in the moment having those symptoms, then it's hard to like make sense of that. So then like
Yeah.
and that kind of trickles out into like friendship relationships, family relationships, because I miss a lot of things because I'm in pain and I can't do stuff or even work. Like I haven't been able to work full time for the past year and a half because I can't, I physically cannot do my job. I have a physical job, but I physically can't do it 40 hours a week. And then because I can't, my body needs to recover from that, like that physical exertion. And another thing that I almost forgot, that's a big part of dealing with endometriosis is infertility, which is actually how I was even cleared for the surgery to diagnose me because my husband and I were dealing with infertility for a couple of years, and we're being told all these, just relax, just blah, 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 it's fine, you're overreacting, and then it because of my age and other factors, like that's when they started to actually take a look at this, and that's how they found it out. So that's also a really difficult and heavy part of this is because some of the treatments for it depend on if you are trying to have children or if you are past that point in your life.
Yeah, absolutely. Thank you so much for sharing about your own personal journey with it and kind of what it might look like. And from what I've heard, it sounds like everyone has endometriosis kind of in a different way. Like, no one is exactly the same. Everything is kind of different for people, similar, but different, and definitely, varying amounts of pain, things like that. When we're talking about like chronic illnesses, chronic pain, something that comes to mind for me, I think it's something I saw probably on on Instagram at some point was the spoon theory. Have you heard of that?
No.
So the spoon theory, it's very interesting. I think I knew someone who had lupus, and I think she's the one who had mentioned it. And with spoon theory, anyone with a chronic illness, I even find like minorly with my anxiety that I will use this spoon theory. And basically, like let's say you start with 40 spoons when you wake up in the morning. It might take you a spoon to get out of bed. a spoon to brush your teeth, 2 spoons to make breakfast. And so halfway through the day, when you're dealing with these other chronic issues that are taking your spoons away, you're not going to have any spoons to do anything for the rest of the day. And so it's people with these chronic conditions are finding it difficult to even just like daily tasks because your energy is being used on yourself to deal with the pain and deal with, your symptoms. Would you agree? Would you say that that's kind of something
100%.
that you felt?
100%. I
Yeah.
love that theory. That's actually going to be really helpful for explaining that, I think. But yeah, like,
Yeah.
so on my like peak days, so if we're talking about 20 days out of the month, I'm in debilitating pain. That puts me behind if like just normal daily, just like chore kind of like chore, shower, take care of yourself kind of things. And then if you're working that day or if you can't get the rest that you need that day for whatever reason, or you didn't sleep the night before because you were in so much pain and you couldn't fall asleep, like yeah, that all affects the spoons and like what you're able to get done in a day. And then the being behind, that'll naturally increase anxiety and depression because you don't have time to do things you have to do, let alone things you want to do that are enjoyable. And it, yeah, that's why I keep going back to that snowball idea because it really can feel like you just like compounded with all this stuff. But
Yeah,
having
absolutely.
people in your life that like help you and understand you, so like for me that's my husband or like my family or really close friends or coworkers that or have similar things like endometriosis. The last statistic I read, it's 1 in 10 women, so there are a lot of women that are dealing with this too. So there are, if you're dealing with this and you don't have that support, I really encourage seeking that out because that's been helpful for me. Just like in the validation part of like, no, I'm not crazy. Like this is what's going on, and just because everybody doesn't understand it doesn't mean it's not real. Like this is real, and having people to help with that kind of stuff is really important.
Exactly. And I love that you're open about it. And I love other people that I know who have it, who are open about it, can maybe make women who are going through it, who are afraid to maybe say anything or aren't sure, like they're feeling those symptoms, but haven't gotten a diagnosis, aren't sure what's going on, to maybe come forward and talk to someone just to get that validation. Because especially with the medical field and with with a lot of female disorders, especially around like the reproductive system and things like that. There's
Mm-hmm.
just a lot of questions, unfortunately. So just having the support that even though you have those questions, like
Yeah.
your feelings are still valid, and to
Yeah.
kind of stay the course until you get a diagnosis that is real, that
Mm-hmm.
fits kind of what you're feeling. So how can someone with endometriosis, so I know you said like for you 20 days
Mm-hmm.
out of the month is like
Mm-hmm.
really hard. So
Yeah.
how can someone with endometriosis stay consistent in their journeys to reaching health and wellness goals? Like what can that look like? Is it possible?
It's a really great question. I love that you ended on is it possible? Because it is. But I think the biggest part for me was was accepting like not just accepting that like yes I have this is a thing I'm going to be managing, but that accepting that my health and wellness goals, like the path to get to there, is not going to look how it looks like online, like on Instagram, like, oh, just do this program Monday, Wednesday, Friday every week and you'll have these results in 6 months. Like that's not, that kind of a consistency is not something I can adhere to because like I don't have like, oh, every Monday, Wednesday, Friday, like a lot of those are pain days and I can't get off the couch. But you can be creative and flexible with what consistency looks like. So, like, you can. So, for me, I was trying to do a workout program that I wrote for myself, and it was 4 days a week of stuff, and that wasn't possible. So, I pared it down to more realistic and like low impact versus high impact, and like paying attention to what I'm doing and just adjusting my goals. So like my goal went from being consistent, meaning like 4 days a week doing the specific workout, to moving my body a few days a week. And I don't have it on specific days. I just have it as like the little checkbox, like for the week. And then also recognizing that like the week I'm menstruating for me is just, it's like out of control pain. So if I can get a couple of walks in outside and like just hear birds or whatever, just breathe fresh air, that counts. Like still, that is me doing what I can do and I'm still moving and I'm still doing it. Or you can also, instead of focusing just on like the exercise part, like we kind of talked about earlier, like, okay, well, right now I can't focus on exercise at all, but I can focus on fueling myself in a way that like helps my body like feel its best and recover its best. And also maybe helps my mood a little bit. Like maybe I'll have one of my comfort foods with some healthy stuff, and like I'll focus on having my nighttime routine and getting to bed on time so I can sleep. And then the next day will be a little bit better because I got good sleep, that kind of stuff. So just recognizing
Hmm.
that it's different and then finding what consistent looks like for you, I guess.
Yeah, I love that. I think it's so important. With one of my current clients that I have, who also deals with endometriosis, it was my first time really kind of like coming to understand what it all entailed, how this person feels throughout the week, and for me as a trainer, just kind of newly coming into this, I want to think about it from your point of view or from the point of view of someone who's going through this. And if what I kind of figured out, like if laying down feels good for your body in that moment, in those pain moments, there are exercises that you can do, strength exercises you can do while you're laying down.
Mm-hmm.
You can do it
Yep.
from your bed, you can do it on the floor, wherever you're
Mm-hmm.
comfortable.
Yep.
um, and the really good thing about at least the programs that I put together is they are flexible. And so if one day you're like, I am in so much pain, can we push this workout a couple days out? Totally, absolutely. It's just about allowing yourself that flexibility and that grace when you're really not feeling it, because we know that like consistency isn't always going to work for everyone. Some people with, let's say, like, I don't know, even some people with like kids, I guess, too, like your schedule looks the same day to day. The kids go to school, you go to work, you have this hour before you pick up the kids from school. That's your workout hour. Like your body's always feeling good for the most part. So, like, that's what's going to work for you. But that's just not the case for everyone. And so, finding, what time of the day are you feeling better? It's kind of like the 80-20 rule. Like, you want to be good 80% of the time,
Yeah.
but that other 20% is just life. It's the realistic part that's just not going to fit
Yes.
sometimes. And that's okay.
Yes. And I will say you
Yeah.
reminded me too with the like laying on the couch and doing what you can do. Even sometimes like I scaled it back from exercise, like workout strength stuff to just getting my stretches in. And I will give myself as much time as I need to do that because I know I'm spending the whole night on the couch anyway. So I'll put my favorite show on. And if I do one set of whatever stretch it is. And then I need to lay down for 20 minutes and I lay down for 20 minutes and I'll do my next one. And I have my little like check boxes. So that's what keeps me like motivated and like reminding like, oh, okay, can I do this right now? Okay, I can do this now. And like, yeah,
Totally.
yeah, but
I
just
love
not
that. And
being
I love,
rigid. It's the flexibility really is so the flexibility and the like having compassion for yourself. Because
yes. Yeah.
I think too that like with something like a chronic illness, whatever it is, like if there is a part of like there's a part of you or there's a part of me that feels like I'm not in control of my body and I really don't like how that feels. But and it I can sometimes, or I used to, I guess, think about it like it's like that I'm weak. But people
Mm,
who are dealing with chronic stuff like this, especially like a chronic pain thing, like you are so much stronger than you are giving yourself credit for because you are doing this like everyday stuff, fighting through all this pain. So give yourself credit and make sure to like remind yourself whether it's writing it down in your workout logbook every week or sticky notes or whatever you got to do, like that you are a very resilient person because you are doing all of this despite being in extreme pain and all that kind of stuff. So anybody with chronic stuff, just remind yourself of that. So just give you a little umph.
yes, I love that so much. That also reminds me of like our health coaching times. Like I know you were such an encourager to your clients and to the people that you were working with. Like you are just the best at encouraging people to just do what they can and to give themselves grace. And I love that so much about you.
Thanks. It's important
Oh my
though.
gosh.
Like everybody is working so hard and it's so easy to like compare yourself to what it looks like other people are doing, but like check in
Totally.
with you too.
Absolutely. I'm also really glad that you mentioned stretching, because within an exercise program, if someone's thinking like, oh, I didn't work out, like all I did was stretch, like stretching is still so important. And on some days with my clients, if someone's body hurts, I'm like, great, let's stretch, let's do a little yoga session, let me run you
Yeah.
through some yoga, because your body's telling you that it needs a break, that it needs something. And even
Yeah.
just moving through range of motion is so good, and is enough, is
Yeah.
plenty.
Yeah.
It's not less than a strength workout. It's you're
Mhm.
moving your body, you're giving your body what it needs, listening to your body. I think people with chronic illness, endometriosis, like
Mhm.
y'all are really good at listening to your body and what it can do and what you're ready for in that day. And I love that. And I think it speaks a lot, even just to, people who might not be dealing with that, to just
Mhm.
really listen to your body and just, allow yourself, the breaks when your body's asking for it. In personal training, we do deload weeks. So there's, maybe after maybe like 8 or 12 weeks, we'll take, a week of just deload of less weight, less cardio, just to kind of let the body recover, as the body needs
Mhm.
recovery. So
Mhm.
finding that. And yeah, I mean, we need scheduled rest and scheduled breaks, and your body's going to tell you when it needs it. So
Right. And your body like if it doesn't have the rest, then it can't like grab all the proteins and all that to build up the strength and muscles and whatever else you're working on. Like it can't do any of it without rest. We're back to sleep again, but it's so important.
back to the sleep. I love that so much. My gosh. So, from the perspective of being a health coach, how would you, outside of like the great encouragement that you gave, how would you best coach someone who has endometriosis?
All another great question. And I recently, maybe 4 months ago, I figured out, or I saw somewhere probably, that to have like plan ahead for the different kinds of days that you have. So like while you might not know like if the pattern of like how this disease looks with your within like the cycle of a month, you're not going to know like every day for sure how you're going to feel, but you probably have been dealing with it long enough that like okay, someday like I have a lot of energy and like a lot of like energy to put towards my health and wellness goals on some days. Some days kind of meh, some days just not happening. So kind of like all star, like rock star day, and a meh, and then like a heck no day. And just having different plans for those different days so you don't have to think about it in the moment, because in the moment you're not really, you don't have all your tools at the ready. So like whether that's focusing on like having different plans for different days as far as exercise or nutrition or sleep kind of wellness, self care stuff, like whatever that is, just having those already there that you can just refer back to if it's something you even feel like you can tackle that day, that was really helpful. So it just took a lot of the thinking and extra energy that I needed out of it. So I can just be like, okay, so we're not doing this today, but maybe we'll put on I Love Lucy and do some stretches and then I'll have a nice snack after that. Like something like that. Or some ginger and lemon water and whatever it is that I'm doing.
Yeah, that's cool. So you're saying like maybe write down three different options, and then so that you have it at your disposal, so that you're kind of taking the thinking out of it, because like you said, like a lot of times like the thinking is the hard part and trying to come up with something in the moment. So when you're feeling good, to find those
Mm-hmm.
three options, like level 1, 2 and 3, what you can do when you're feeling a different way, and then that way you can just look at it and say, I'm feeling like I can do this today.
Exactly. And also recognizing that, especially at the beginning of that, ideas you come up with are not going to be the ideas that you stick with. Like you have some great ideas and some of those are not going to work out, but still keep track of those, like keep whether it's a paper or notebook or whatever you keep track of stuff on. Have that because then you might end up seeing patterns of like, oh, I keep trying to do these like high intensity things on my meh days and I don't ever get through those. So maybe I need to look at like bike riding or going swimming or something that's just lower impact and easier on you. Maybe that'll open up some doors, open up some ideas, kind of, yeah, flexibility and flexibility and
Flexibility.
planning. Really, yeah. I can
Oh,
admit.
that's so good. I like that a lot. That's so cool. So I have heard from so many women at this point that their doctors don't take them seriously or don't listen to their concerns about their own body. And I've heard this from clients of mine, and it is so incredibly frustrating to hear.
Mhm.
And yeah, that's
Yeah.
we'll talk about that another time, but it's just so incredibly frustrating as a woman to hear that that's like happening from like the medical system. So I know that you've been through a multitude of doctors.
Mhm.
um, and I'm curious, what are some like actual remedies that can help someone with endometriosis feel a little bit of relief from their symptoms. It could be just in general, whether it's something that can help in the moment, if it's something that, if there's something out there that's like ready to fix the problem long term. What have you seen?
So so I only recently got in to see a specialist. I had to wait, I think, like a year to get in to see them. So that part of it is new for me. Before that, things that helped with like anti-inflammation would sometimes take the edge off. Sometimes I could do like an naproxen sodium or like a ibuprofen that would sometimes work. That usually didn't do the trick. To think here, swimming actually, like not swimming like doing laps, but like going into water and just floating, that helped because there's no weight on anything. It's just you're kind of sitting.
Mm.
So if you like live near a place where you have access to that, by all means try that. um since seeing my specialist, I've been on, trying to think of the name of the medication. It's a hormone medication that suppresses estrogen. So it's, the way she described it was, it's like if you have your birth control pills and then you take all the ones with the hormones in it, and then you would basically skip the placebo week and keep taking them.
Okay.
So you don't get your period. And that has helped. That helps from the lesions to stop growing, and they won't pop up in new places. So that kind of halts them. And then she also prescribed me a muscle relaxer to sleep at night, and that what that does, it helps you fall asleep. It also, and it doesn't have like side effects. It's not like an extreme muscle relaxer. It's real benign, but it helps teach your body again to learn how to relax. Because likely, if you've been dealing with this for a while, your body just doesn't know how to relax. It's all tense and clenched. So doing that. Then I have, I'm still in the process of this. I just want to say, but I have a pelvic floor physical therapy that starts in a week. That is supposed to also teach your muscles like how to fire properly and just get them used to how they're supposed to be working. So that'll help with the muscle imbalances and just feeling better. And she has, from what she has told me, that the majority of people see extreme relief in 3 to 4 months. And so I've been on the medication so far for a month, and I have noticed relief from that. Like I still have pain, but it doesn't like take me out for the whole day. It's a few
Okay.
hours instead of the whole day, or it's pangs. And then I can just like take a break for a little bit and then like go about my day again, which is something I haven't been able to do in years. So that's really
Oh,
exciting.
wow.
Yeah.
That's amazing.
Yeah. Yeah.
Wow. Okay. So what I'm hearing is that there's hope, and I
Yeah.
know that you've been through like your, myriad of doctors and
I've been
everything.
through it.
So, but
Yeah.
you found someone who listened to you, who heard you, and who does this doctor have like a bed? Is this what they specialize in,
Yes.
or like okay,
Yeah, it's a specialist through U of M, which is like in Michigan. That's like one of the best hospitals, if not the best hospital we have up here. So that she has been focused on this for like decades. So she's kind of been in it and seen all kinds of it, all kinds of what goes on, like how different this disease can look and what different people, what will help them and not. So, but it took me 2.5 years of like fighting, like arguing with doctors to get them to get so I could get to see the specialist. So, and I'm not like a confrontational person at all. I really hate confrontation, but I would encourage you, if you're like in it, like just like still in the like trying to get people to believe you and trying to get the help that you know you need, to just keep advocating for yourself. And if that means that you take a sharper tone with your doctor than you would, then do it, because it's it's about your quality of life. So, and
yeah,
I had a friend come with me to one of my appointments because I get so nervous and flustered with like trying to get people to believe me when I think they're not going to believe me. And they came with me, and like there was a point where I was like kind of getting lost in my head, and they jumped in and were like, I just want to make sure you're hearing her. This is what she's saying. Like I've been with her for this. Like this is this. Like, and she's not exaggerating. Like this is da 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 da. And that like kind of like, oh yeah, yeah, I am. Yeah. Okay. Now let's keep talking. Da, da, da. So whatever
that's
you got to
amazing.
do, do it.
That is incredible, Jaclyn.
Yeah.
Yes, I love that. Bring a friend, bring your support system if
Yes.
that's what it's going to take to
Yep.
get you heard and seen. Oh,
Yep.
I love that. Well,
Yep.
I'm so glad to hear that like you're starting to find like some relief and that you're finding yeah, just some like help in that area. I think that's awesome. And I'm
Yeah.
interested to hear, in like 4 or 5 months, if it's improved even more, like that would be amazing.
Yeah.
And um, I know that like probably not everything is going to work the same for everyone. So like
Hmm.
what's working for you, Jaclyn, isn't going to work for the, exactly the same for the next person.
Yeah.
But I love that you found someone who's willing to like work with you and find what's best for you. I think that's incredible.
I agree. It is. I'm so grateful.
It's been a long road.
Yes. But I'm also grateful to be here and get to share this because if it helps like a couple of people even just feel better about what they're going through, then this has been great. That's what I would love to do.
Totally. And it's been so educational for me to just learn more about what someone with endometriosis is going through. It helps me to better understand clients who are going through it or just other women who just are, talking about their issues. Because as you said, if it's 1 in 10, like that means we are surrounded by women who are going through this and we need to be there to lift each other up and support each other through it all.
Yes. Love that.
Amazing.
Yes.
All right, so I have a new segment for this show, and it is called Absolution. It is the new part of my show where you tell me something within fitness culture that you think should be absolved and something that we can free ourselves from the guilt and punishment of. What do you got for me, Jaclyn?
Enjoying tasty snacks. Like this food
Ooh,
shame stuff. No, you can have Oreos, you can have Cheetos, you can have chips, you can have all of that on your health journey, whatever your goals are. And I'm tired of people shaming people about Oreos and stuff because it's so good. And let's not pretend that we all don't love junk food because we do. Whatever it is, everybody's got their thing. And I know we talked about this a lot with our previous health coach job, but like you can do healthy additions. Like for my example, personal example, my comfort food is mac and cheese, and I can eat mac and cheese 5 out of 7 days of the week, no problem. But I found if I add like protein, like chicken or tuna, and then add like peas or broccoli or whatever, just bulk it up, then it's so satisfying and I don't eat the whole box and I feel better. I don't feel like I need to spend the whole, rest of the day in bed because I ate way too much noodles and cheese. Like it's kind of filling in the whole picture. Or like
I
Oreos.
love
I can eat 4 Oreos with Greek yogurt and some berries instead of a whole sleeve at once. And then I have energy and, yeah, there's ways to do it.
that.
So eat your food that you love.
As of today, we are absolving ourselves of feeling guilty and shaming other people for eating junk food when we can eat whatever we want and feel
Yes.
okay about it because we are fueling our bodies. And dang it, if we can enjoy our life, we're going to do it.
Yes. Yes. You can find the balance, flexible balance. Everybody can do it.
I love that so much. Well, thank you so much for joining me, Jaclyn. I'm so glad that we could have this conversation. I think it's been really educational, really informative, and hopefully has brought a lot of hope and just validation to a lot of people.
Thank you so much for having me. This was lovely.
Of
I'll
course.
give you an update when I have one. Hopefully a good one.
Yes, yes, please do. And I will share the update with everyone when it comes.
Great. Great.
Thank you so much, Jaclyn.
Thanks.